Hey guys, it's me, Rachel. Ask Rachel the PA. So, wow, I asked if anybody wanted to watch these video series, and I've got a lot of feedback and interest in it. And one of the first questions from that group is something that could probably be considered very controversial. And the question was, what's my opinion on wearing face masks right now? Just to add light to this or a little more information, our city voted last night. It was a big debate on whether to mandate masks in the city. And wow, I mean, people are heated on both sides of the subject. I am very much against discussing politics in public because I think it just creates a lot of grief and it's not worth it. And I've yet to see a political conversation that changed anybody's mind on their belief system. So I just really avoid and try not to engage in that. So when we talk about masks, I'm looking at it from the medical standpoint. And I did do some research because I'm all about evidence. And so I was able to find 3 studies about face masks. So we're going to talk about those today, and then we'll kind of wrap up with my opinion on it. But I definitely don't want to get into the political side of the masks. This is totally my opinion on the medical side based off of studies. So let's get started. The first study is from 2009. It was in the Emerging Infectious Disease Journal, and it's titled Face Mask Use and Control of Respiratory Virus Transmission in Households. And they compared surgical mask to an N95 type mask to no mask. And they took a group of families, I think it was 297 households, and they randomly assigned each family to one of those 3 groups. And what they found is that the people that were adherent to the mask, which used it like they were supposed to, they had a significant reduction in infection, up to 80% less likely to get infected if they wore a mask. Unfortunately, less than 50% of the families or people in the study were adherent to using the mask properly. So less than half were able to follow through with the mask during the respiratory illness. They were studying the flu is what they were really after, but there were other viruses going around at the same time, so they weren't exactly sure how many of these were flu cases for sure, or that didn't have a secondary respiratory. But all that to say, 80% less likely to get infected if you were compliant with your mask. Okay, so that's the first study. The second study is called The Impact of Population Mask Wearing on COVID-19 Post-Lockdown. This was in the Infectious Microbes and Diseases, and it was published very recently, June 5th, 2020. What they found is that masks can decrease mortality when critical care capacity is limited and when it's not limited. What they're concluding is that when home confinement is lifted, but social distancing measures are in place, wearing masks can maintain the benefits of the home confinement in terms of death rate and in terms of critical care bed use. So they're saying the mask is almost as good as a home confinement if people continue to social distance and if they wear the mask. Again, if, that's a big deal. The third study is face mask use in the general population and optimal resource allocation during the COVID-19 pandemic. This is a pre-printed study. It has not been peer-reviewed yet. It is on the National Institute of Health website if you wanted to go look at it. They're saying that even if 10% of the population wears a mask, we may see 5% fewer deaths. That's a pretty significant number, I think. So let's just kind of recap here. The problem with COVID right now is that it's highly infective, meaning it's easy to spread. There's no vaccine yet. And if everybody were to get sick at the rate that has happened in Italy per se, we don't have enough ICU beds or ventilators to meet those needs, which is why the shutdown started in the first place, is they're trying to prevent that overload on the hospital system. I think a lot of people were like, well, the death rate's really not as high, or it's not that bad. But for me, from the beginning, it hasn't been necessarily that I was scared of the death rate of COVID. It's that percentage of people that need help to get over COVID. One study had shown of every 100 people that get COVID, 86 are going to be just fine, either no symptoms or very mild flu-like symptoms, and 14 are going to get very, very sick. And of those 14, you've got to put them in the hospital, and some of them are going to need help breathing with some sort of breathing machine. And so that has been the concern from the beginning, is we don't have enough resources to meet that need if we all get COVID at the same time. So just some conclusions from this. I definitely think the elderly should be wearing a mask. If you are sick, you absolutely should be at home, but you should also be wearing a mask at home around your family, just so that they don't get it. And to me, a mask is one of many strategies. We should still be social distancing. We should still be avoiding travel to places that are high on the radar for case outbreaks. And if you get it or you're exposed to somebody, follow the quarantine recommendations, which is a 14-day quarantine. That means you don't go to the grocery store. You don't go visit cousin Sally. You don't go anywhere. You stay home unless you want to go get tested to see if you don't have it. Then you don't have to necessarily be on that 14-day quarantine. So the problem I see with masks is most people don't wear them properly. I see a lot of the mask going under the nose. People are adjusting the mask. They're pulling it down, wearing it on their chin. They're pulling it up. That negates the point of the mask. So do masks work? Yes. You have to wear it properly though, and you have to keep it on. You can't be taking it off, taking it down. Now, as far as type of mask, there's cloth masks that come in all different fabrics. So I can't say that all cloth masks are equal. Personally, when I go out, I am wearing a surgical mask. And to be even honest about that, a few weeks ago, we had 0 hospitalizations in our town for weeks, and we weren't seeing any respiratory symptoms. So during that time, I didn't wear a mask. I went to the store without a mask. I let my kids go to the store. And then all of a sudden one day, boom, one of the hospitals in town had a full COVID unit, and we went right back to wearing our masks and kids not going out to the store for now and that sort of deal. So, guys, nobody knows the right answer, and we're all just trying to get through this together. But I would encourage you to consider wearing a mask, and if you're going to do it properly. And you could be spreading it and not have symptoms. That's something we're seeing. There's more studies coming out on how many people may be asymptomatic for how many days. Maybe they are asymptomatic the whole time they have it. Maybe they're, without symptoms for a couple days, and they're shedding the virus and passing it on, not realizing it. So the mask is really to protect other people, not to protect you. And when I go out to the store, I wear a mask not because I'm afraid. I've already been exposed. I'm not afraid to get it. I don't want to be the person that spreads it to you because I'm in the high risk job of what I do, of swabbing people and assessing people with symptoms. So that's a long video to answer one question, but I appreciate the question. Again, not trying to be political. This is totally based off of research and the medical side of it. That's all I want to talk about. Thanks, guys.